Good afternoon, everyone. The information I provide in this update is accurate as of January 26th, 2022. Our region continues to be impacted by the Omicron variant. Our 7-day average percent positivity rate is 23.5%, while our all-time percent positivity rate is 2%. This highlights how transmissible and fast spreading the Omicron variant is. We continue to provide information on hospitalizations and occupancy levels. However, these numbers fluctuate regularly and are more meaningful when we look at trends and not at the day-to-day changes, as 1 or 2 days with a drop in hospitalizations does not mean there's less risk or impact in the region. Because the hospitalization reporting changed at the beginning of January to include only statistics on those hospitalized from COVID and not with COVID, we need to wait a little longer until we have enough data to show trends. Once that is possible, we will include a weekly graph on the website. In addition, because the day-to-day numbers are not so meaningful, like many other health units in Ontario, including Thunder Bay District Health Unit, as of next week, we will only report COVID-19 data on Mondays, Wednesdays, and Fridays. A reminder to visit www.ontario.ca/exposed for anyone who fails the online self-assessment tool or those who test positive on a rapid test. The website will tell you what to do next based on your circumstances. Positive rapid tests do not need to be reported to public health, and the individual with symptoms or a positive test is expected to follow up with their own contacts themselves. Those who have tested positive for COVID-19 should not require a negative test to return to work, as testing eligibility is limited, rapid tests are not easy to attain, and people can test positive for the virus for a number of days after they're no longer infectious. As of January 31st, Ontario will begin easing COVID-19 restrictions on some businesses, most at a limit of 50%. Social gathering limits will increase to a maximum of 10 people indoors and 25 people outdoors. I encourage everyone to follow all public health measures to protect our communities, including frontline workers, and to ensure our local businesses can stay open. Our Section 22 order has been updated to reflect the changes in test eligibility and case and contact management. It has been expanded to those who test positive on a PCR or rapid antigen test, and it incorporates the new isolation guidance. The document has been posted to our website and shared with applicable partners who use the Section 22 order regularly in their work. The National Advisory Committee on Immunizations has strengthened their recommendation on the use of the COVID-19 vaccines in children 5 to 11 years of age. This National Scientific Committee now recommends that the vaccine should be offered to those aged 5 to 11 years of age. Previously, their recommendation was that it may be offered. In outlining the new recommendation, the National Committee outlined 2 things. One, that there is additional real-world safety data from the United States indicating that the vaccine is well tolerated in those who are 5 to 11, and that the cases of myocarditis have been very rare and lower than what was observed in the adolescent age group. And 2, that although children 5 to 11 are at low risk of severe disease, the number of children experiencing severe disease or hospitalization is increasing because of the large number of children being infected with the Omicron variant. Getting vaccinated against COVID-19 continues to be our best way of minimizing the impact of this pandemic and for the possibility of future variants. There's consistent evidence that a booster dose provides moderate protection against infection with the Omicron variant, and even more importantly, provides very good protection against severe disease with this variant. COVID vaccine is saving lives, and I encourage you to get vaccinated as soon as possible. Our case and contact management team is seeing that repeatedly when managing outbreaks, our case and contact management team is seeing that when they manage outbreaks in high-risk settings, that vaccination makes a significant difference in reducing the risk of people being hospitalized. In our region, over 173,000 doses of the COVID-19 vaccine have been given. Over 86% of those aged 5 and older in our region have received 2 doses. I'm happy to report that our region has above average provincial coverage rates as a whole. Currently, our booster dose rate for those aged 18 and older is over 55%. And for kids aged 5 to 11, over 57% have had their first dose. We are seeing great interest through the consents sent home from schools and will be vaccinating children with signed consents in schools over the next few weeks. Our vaccination clinics continue, and I encourage everyone who is eligible to get vaccinated for COVID-19. Appointments can be made on our website, and walk-ins are posted there as well for those who prefer not to have an appointment. For those living in smaller communities without regularly scheduled clinics, there are a few options on how to get a vaccine. They can book in a larger nearby community, or they can call their local public health unit office to be added to a wait list. Once we have enough people signed up to run a clinic, we will phone the people on the wait list with details. This information can be found on our website.